What about the sir? Oh, I'm private Katagandi, Kianda. You just call that, yeah.
Cardiopulmonary resuscitation, or CPR, is an emergency life-saving procedure that is performed when a person stops breathing and the heartbeat has stopped. This is known as cardiac arrest. CPR combines rescue breathing with chest compressions. The purpose of CPR is to keep oxygenated blood circulating to the patient's brain and heart until a cardiac rhythm has been restored and the patient has a pulse again. Permanent brain damage or death can occur within minutes if blood flow stops. CPR is usually combined with cardiac defibrillation, either manually or with a semi-automated external defibrillator, an AED. Additionally, advanced life support personnel may administer medications to assist with this process. However, the most important part of any resuscitation is proper chest compressions. In 2008, the European Resuscitation Council and the American Heart Association endorsed the effectiveness of continuous chest compression, CPR, which does not include the breathing component. This is commonly used in community-based CPR education. For EMTs, it is still important to do CPR at a ratio of 30 compressions to 2 breaths, while the patient is being transported to the hospital. Now we will provide a step-by-step explanation of how to provide CPR to an adult patient. First, check the responsiveness of the patient by tapping on their shoulders or gently shaking them while asking, "Are you okay?" If the patient is unresponsive and you are alone, call for help.
Hello, sir.
Then open the patient's airway with a head tilt, chin lift method. If the patient is a trauma patient with suspected spinal injury, consider using a modified jaw thrust. Check to see if the patient is breathing. Look, listen, and feel. Look to see if the patient's chest is rising and falling. Listen for breathing sounds and feel for exhaled air. If the patient is not breathing, provide 2 rescue breaths. Then check to see if their chest rises or falls, which signals that they have received the air. Next, check for a carotid pulse for 5 to 10 seconds. If no pulse is found, immediately begin chest compressions. Be sure that the patient is on a firm surface. If not, move the patient to the floor prior to starting chest compressions. Place the palm of your hand in the center of the chest, between the nipples. Interlock the fingers of your hands. Lock your elbows and press down on the chest. Compress the chest approximately 1/3 of the thickness of the chest and allow the chest wall to completely recoil after each compression. Compress the chest at a rate of 100 times per minute. While giving chest compressions, remember, hard and fast. Press hard on the chest wall and fast at a rate of 100 compressions per minute. Give 30 chest compressions and then deliver 2 breaths. Avoid pausing or stopping chest compressions. Never stop compressions for more than 10 seconds. Continue to deliver chest compressions and ventilation until the patient regains a pulse, starts breathing again, or you determine the patient cannot be revived. Reassess the patient's pulse after every 5 cycles of CPR, which should be approximately 2 minutes. Providing effective chest compressions is the most important component of CPR, and providing chest compressions is hard, exhausting work. If more than one person is available, you should change the role of compressor every 2 minutes. Now, let's look at the complete CPR process in detail. First, be sure that you have gloves on your hands. Ensure the scene is safe and check the patient. Next, open the airway with the head tilt-chin lift. Look, listen, and feel for breathing. If the patient is not breathing, deliver 2 rescue breaths. Then, check for a carotid pulse on the side of the neck closest to you. If pulse is not present, start chest compressions. Pay attention to the smooth, consistent chest compressions at a rate of 100 per minute. After 30 compressions, provide 2 breaths and stop to observe the chest as it rises and falls. Resume chest compressions. After 2 minutes, check for a carotid pulse. If 2 EMTs are available, then 2-person CPR is preferred. The first EMT will provide the rescue breathing component, and the second rescuer will do chest compressions. With 2-person CPR, use the same compression to ventilation ratio of 30:2. To prevent fatigue, you can change the roles of compressor and ventilator every few cycles. If an advanced airway such as an endotracheal tube has been utilized, the CPR method will need to be modified. Chest compressions are performed continuously at a rate of 100 per minute, without a pause for breathing. Ventilations are also provided continuously at a rate of 10 to 12 per minute. Continue chest compressions and ventilation until the patient is resuscitated or is transferred to a hospital. Successful CPR demands or requires high-quality chest compressions without interruption.